At Timex Nutrition Center, we advise you on the right foods to eat, exercise profile to adopt, and lifestyle strategies which are compatible to your blood group and genotype. This empowers your body to prevent and treat many diseases like diabetes mellitus, high blood pressure, arthritis, ulcers, obesity, and many others. Make food your medicine. For more information, find us at our head office on Conrad Plaza Building, Nassau Road, on the second floor, or call 0758 819 952 or 0778 288 361. In the Western region, find us in Mbarara on High Street Amazon Building on the first floor or call 0754 918 590. And in the Eastern region, find us in Jinja on Main Street Kaki Road, East Arcade 82 or call 0701 458 064. Be your own doctor.
Yes, a very good evening to you, tuned into UBC once again. Welcome to our nutrition talk. Yes, somebody watched this program, the last episode we had last month, and he said, I enjoy the nutrition talk that you had. So, Doctor, I picked the name there for this program. Yes, so my name is Michael Jordan Lokomwa, and every second Tuesday of every month, we get here to discuss something to do with what we eat for the good of how we live. Our guest is always Dr. Ismail Tamale from Timex Nutrition Center, and he's already here. Doctor, good evening.
Good evening, and good evening, viewers. Thank you very much for tuning on UBC at this hour.
Yes, it is now a whole month since we saw you here.
That's right, that's right.
Tell us about Timex Nutrition Center and what you do once again.
Okay, for viewers who have just tuned in, Timex Nutrition Center, we do what we call Nutrigenomics. Maybe it's a terminology which is not very familiar to many people. Many people are used to nutrition. Nutrition deals mainly with components in the foods, put them in a balanced diet, and then eat them. Now with Nutrigenomics, we go a step further, because with Nutrigenomics, we look at your blood group and genetic information. Then after that, we determine the system will determine, because the system program was already designed in America by Dr. Peter Diadama, whom we represent in Africa. The system will now determine which foods are suitable for your blood group and genotype. If your blood group, for example, B nomad, it will tell you according to your blood group B and your genetic information is GT6N. Then it will tell you that now, according to your genotype, you can take lamb, you can take beef. You can take sweet potatoes, never touch matoke. You can take a dodo, never touch things like cabbages. You can take coffee, never take tea. You can take a turmeric, never to use black pepper. So all these food, you can take a tilapia, never take a mango patch. So all these foods which come out are the ones which support your genes and cells.
Okay.
And the foods which the system leaves out are the foods which are fighting your body. Then after that, the system will also go ahead to tell you what sort of exercise are supposed to be fitted to your genes and cells. Because not everybody is supposed to be going to the gym. Everybody's system has different exercise profiles. Maybe viewers, that's why you see some people go to the gym, they come back well energized, and they like even to go back, and even the following day they are going to go back. Others go to the gym and do aerobics, and they say, I will never go back to the gym. They come out when they're very tired. They wake up in the morning when they are so tired. Some of them even end their journey in gyms. They collapse in gyms dead. So yes, you have seen all this. You have seen all this. So the system here will tell you what exercises are suited to your body system. Then the system also will show you what sort of lifestyle should you adopt as a particular body system. 1, to control stress. 2, to handle stress in case it comes. So that is what the whole thing comes in. Now, if you do all these things, then the body system acquires a very strong immune system. Means it can be able to defend itself. The body system are not meant to be always using mercenaries of medications, herbs, or supplements. No. The body system, if you give them the right foods, they should be able to defend the body system.
When you avoid the foods which are naturally
fighting
designed,
your body system,
the drugs become mercenaries.
Yes. Of course, if you don't take this food as your medicine, then you are going to start taking medicine as your food.
Okay.
So you end up having a very strong immune system. It's anti-aging. You become younger and younger. So you don't need to look for anti-aging supplements and so on. No, you just eat the right food.
Eat right.
Yes. Then also self-feeding. When somebody has a condition like diabetes mellitus, high blood pressure, we give you some few supplements. Now the supplements in Timex Nutrition Center are taken only for 30 days. You take them once in a lifetime. You don't need to take them again because they just put the body system back to formation, and your work to put the right foods which have been recommended by this system into the body. Then the supplements after 30 days, you don't need them. If you are taking any chemical medication, you may continue with it, but now because we have removed what is causing a problem, then over a period of time, the problem goes on coming down, down, down. Then when you go back to your physician, he can start advising you to reduce the medication and even remove it instead of just always increasing dosage, increasing dosage, increasing dosage. So that's exactly what we do at Timex Nutrition Center.
Where are you located?
Timex Nutrition Center is located on...
I'm tired of those questions after the program.
NASA
Tell
Road.
the world.
Yes, we are located on NASA Road on Conrad Plaza building. On Conrad Plaza on the second floor. Conrad Plaza building is the building which has uptake. Where NASA Road joins Etebe Road, you come to Timex Nutrition Center. That is on the second floor. Also, people in the western region, you can always go to Mbarara on High Street. On the the building is called Amazon Building on the second floor. You'll also find us there. Also in Jinja, in the eastern region, we have a branch there on Main Street on the second floor, and on a building called Arcade 82 Madiban House. For people in Mbarara, actually, we are going to have a camp on the 23rd October this month, so please be there. We shall be working on you so many. Those are the telephone numbers on the screen. As you see them, you can always get them on those phones as you see them and as you are seeing them in the advert. That is basically where we are found, and that is what
how to get to you.
Thank
you so much,
One
Doctor.
thing, a new viewer would ask me that I eat food as I've been eating. What's the problem? Of course, viewers, you have to understand that when you eat foods which are not compatible to your blood group and genotype, you don't die there and then. Neither do you fall sick there and then. But this food starts up a slow, protracted, calculated gorilla war in the body system. It will first take you up in the pharmacy, you start getting problems, gas in the stomach, belching, constipation, you start moving to pharmacies, then eventually things becomes bigger, you start going to clinics back, then eventually the clinic mason will refer you to a bigger hospital. Then you start now making the journey to major hospital back. Then eventually one day you go to the major hospital, you will be admitted, and if you're not careful, you'll pass through the back of the hospital into the mortuary. Then another one will come. So that is how the food works. Okay. And of course, we looked at some of the sticks that happens if you're not eating the right foods for blood group and genotype. We looked at things like dosing after meals, things like when you see somebody eating a meal and is dosing, then you know there is a problem in what is eating. Then you have things like belching, bloating, somebody is eating food and then after a sudden the stomach starts grumbling as if there is a snake going through. Oh, those are some of the challenges of, you know, that among the foods you are eating there is a wrong of food. Things like a gas in the stomach, heartburn, things like bad breath, stomach disorders, constipation, sudden loss of energy even after eating a meal, things like indigestion, headache, all these start coming up. But as I said in the first presentation, that these look simple things which people try to work on themselves. They take this aloe vera, they take what, and that one we call it a bachelor's party. Because you can do whatever you want there.
Yes.
But as you continue progressing, eating the wrong foods which are fighting your body system, these so-called simple digestive system problems start turning into diseases. What was gas in the stomach, the next time you go back to your GP, will tell you, do you know what? Now we have got the ulcers. What was sweating, palpitation, you go back, they say now pressure has come, cardiac problems have come. What was eating food and losing energy, coming back, hypoglycemia, the unstable sugar levels in the body, the next time you're going to tell you now, confirmed, you have diabetes mellitus. Then you start getting other diseases. What was constipation over a period of time, you start getting things like a piles, things like a hemorrhoid. Some of these will even carry you to surgery. Things like a piles, things like hemorrhoids, you may end up going for surgery for health. But the diseases coming, pressure, cardiac problems, cancer, arthritis, joint pains, what was allergies in the bachelor's party, you start getting things like sinuses, asthma, and so on. Now when these diseases come in, people, that's when they start getting worried now. And they handle them at that stage. But
after the doctor has announced.
Yeah. Now at that stage, yes, you can handle. Our doctors try to handle those diseases. But because you as a person has not gone back to tackle what is causing the problems will not go. They will just continue increasing dosage from pressure to diabetes to cardiac problems to arthritis to kidney problems, liver, until you see the back of the hospital.
This evening,
that is how it is. So at Timex Nutrition Center, we deal with the root cause.
Okay.
Yeah.
This evening, I want us to look at diabetes.
Yes.
Is diabetes, in the first place, also a problem that can come up because of what we eat?
When we use...
Briefly, because we shall have it in detail.
Okay.
Can wrong food cause diabetes?
Of course, if we use some small common sense, one, there is no microorganism which causes diabetes mellitus. Number two, there is nowhere in the world where they can vaccinate against diabetes mellitus.
Okay.
It's not there. Is that today they say
there is mass exercise to
come
vaccinate.
to the square, we are going to vaccinate diabetes.
So what we eat?
So it is vaccinated in your cup, plate, and glass. But how? That's when you come to Timex Nutrition Center, we'll tell you.
We are coming.
Yes.
What is diabetes? I want somebody to understand it as we start.
Yes.
What is diabetes mellitus?
Of course, what we mean by diabetes mellitus should not really, some of these terminologies should not confuse our viewers. The word diabetes mellitus is what we call, it's a Greek word. It's a Greek word.
Okay.
Which means diabetes mellitus. Diabetes, flowing honey. That's it. Diabetes mellitus means flowing honey. It's so it's a Greek word which means flowing honey. Why flowing honey? Initial tests, people, how they diagnose, how the diabetes came to be discovered. People by that time would do urine, they would have urine which was so sugary. And actually, if you, the medieval systems of testing for diabetes mellitus,
yes,
the health practitioner had to get a small glass and test, then to confirm.
With his tongue?
Yeah, now at least for you have diabetes mellitus.
Oh no!
Before this modern test came in, so it is flowing honey. That's diabetes mellitus, and it's purely a digestive. Most of it, as we shall see, one of the major causes, about 75% of the causes is food.
Are there different stratified types
we
of diabetes?
have 3 types of diabetes mellitus. We have what we call diabetes mellitus type 1, and diabetes mellitus type 2, and gestation diabetes.
What are the differences?
The difference is we have diabetes type 1. Now, that one, as we shall see soon, is, you see, diabetes is a metabolic disease. Now, as we are going to look at this in detail, but diabetes type 1 is where the pancreas, in the body system, there is an organ called the pancreas.
Yes.
The pancreas has got what we call beta cells. Beta cells produce insulin, okay? And the work of insulin is to open up the insulin will move with the glucose in the blood, as we are going to see. The work of the insulin is to open up the body cell, okay, so that the glucose can enter and it is burned to get what we call ATP, body energy, for you to work and do all sorts of things. Now, with the type 1, no, or at times no insulin is produced at all by the pancreas. So it's not producing the insulin, and that is what we call type 1. Now, we have type 2. That one, the pancreas will produce the insulin, but the body cannot use that insulin to open the cells for the glucose to enter. So that is type 2. Type 3 comes in as a gestation diabetes, which usually is for women who are pregnant.
Okay.
Of course, when women get pregnant, there's a lot of change in what we call change in hormonal balance. Some of them put on weight, and the insulin may not be enough to cover the body system, as we shall see some of the major causes of diabetes, as we see. So that is those are the 3 types of diabetes which we have.
What actually goes wrong within the body?
Okay, what goes wrong within the body? Now, if we are going to look
somebody is born normal.
Yes.
What happens that now leads to diabetes, no matter what type?
Okay. First of all, let's look at it. I'm going to demonstrate it with a video.
Yes.
For our viewers to understand. When you eat food, we shall begin where that video begins. Where they're explaining what we call diabetes mellitus. When you eat foods in the body system, okay, the food goes in the stomach.
Okay.
And when it goes in the stomach,
I think producer will give us the video that will give us an illustration.
When it goes into the stomach,
there it is.
Okay, as it comes,
yes, it's there.
As you see, the food will go to the stomach. The stomach is like a factory. Okay, the food is received there, it is churned up, and now these things, what we call these foods we eat, like the carbohydrates, the chapatis, the bread, the portion, and so on. Okay, for example, if they are carbohydrates,
yes,
okay, they are broken down into simple sugars called glucose. Now that glucose naturally is supposed to enter the body cells. First of all, the glucose will move into the blood. Then from the blood, it's supposed to enter into the body cells, the tissues, the body cells. Okay, so that you can get energy to work and dig, run, and so on and so on and so on. And so on. But for that glucose to enter into the body cells, below the stomach, that yellow thing is the stomach.
Yes.
Below the stomach is what we call a pancreas.
Pancreas.
That pancreas has got the beta cells which are supposed to produce insulin. Now, when the foods, the sugars have entered into the blood system, okay, the brain is triggered. The pancreas will be triggered to bring insulin to ensure that the glucose that has been made enters into the body cell. Now, if you look at the yellow is the glucose, and the blue is the insulin from the pancreas. You see, when the blue comes, it opens. Then the glucose enters into the cell.
Yes.
So the blue is the insulin. Okay. It comes, attaches itself, it opens, and then the glucose enters there, and then it is burned. That's for a normal person who has been eating right, is very healthy. So, but now, problems which come, problems as we are going to see. So, the insulin will maintain a particular sugar level
within the body
system, which is very fine for all the organs to be healthy. Now, that's not what usually happens. Now, that is what happens in the normal life. Now, diabetes mellitus comes how? Type 1, the factor, as I said, the insulin, the pancreas, as we are going to see it, the pancreas does not produce the insulin, that blue thing. Okay? So the factory closed. The factory is closed, which is supposed to bring the insulin. But you are eating. Okay? So as you continue eating the foods, the glucose will start going into the blood system. Okay? Now, when the glucose start going in the blood system, it cannot enter into the cells to be burned. Why? Because the key, which is the insulin, is not there. That's why, so that is type 1 diabetes.
Yes.
The factories have shut down. If we are going to see reasons what causes those factories to shut down. Because by understand now, you see now the insulin is not there. Okay? Nothing, there is nothing to open for the glucose to enter into the cells.
Okay.
So the glucose is going to float in the body. And when it floats in the body, it floats in the body, it has nowhere to go.
Just, I want somebody to understand very well. So what causes, I'll take you a little back, what causes for the insulin to stop, what stops the production of insulin?
That's what we're going to look at, what causes diabetes.
Okay.
Because that's basically that's not what it causes, because that's what causes the diabetes. So eventually somebody starts urinating all the time. Why? Because now the sugar levels are high. And the body system has to maintain this level. The insulin is not there to help in burning it, and so somebody has to be going to the toilet all the time, is frequent urinating. As you are urinating, you are losing water, you are getting thirsty, you get things like a rash, genital itching, you get quite a lot of things. You see things like, because now the sugar levels are high and the body system is fighting, and because there is no slow healing, there is no glucose entering the cells, it means that the body system needs energy. So it may start eating already the existing tissues. That's why some people, when they get diabetes mellitus, they lose weight and they become almost like skeletons. So that they will get blurry vision and all that sort of. So that is what we call diabetes type 1. Those are some of the problems you get, like tiredness, you start getting tired, because why? You are getting tired, there is no glucose that is entering into the cell. You are feeling hungry, you are eating, and the glucose is not entering the cell. And so this type 1, it used to be called juvenile diabetes, because it used to actually to be in younger children, people born with a disability. It can be a disability that somebody is not born with the insulin. The factories are naturally lame. Like you have somebody born without eyes or born without a nose. So that could be a disability. But however, these days, even it is coming among the big people. This factory completely closed down, and we are going to look at why they closed down and how they can be resurrected. Now, we got type 2 diabetes. This is the most common one. It affects about 85% of the cases of diabetes. The other one is about 15% where the factory is completely shut down. Now here what we are going to see, the factories are working. The pancreas, viewers, when I talk over the factory, I'm talking over the pancreas.
Yes.
And when I'm talking the pancreas, I'm in the beta cells. Now the factories are working. But now they have been interfered with. And I'll tell you, so that's why when we come to the causes, you'll be understanding now what I mean.
Yes.
The factories have been interfered with. The pancreas is there, somebody is eating the food, the glucose goes into the blood, and the message goes to the pancreas to release the insulin, and it releases the insulin.
Proper.
But the factories now are producing fake insulin. They are producing fake what?
Insulin.
Fake insulin.
Why?
Because they have been tampered with, because we are going to see a lot of reasons why the factories go berserk. Because that is the major cause of the major cause of diabetes, is starts with the pancreas, that factory. Now the insulin comes, but it cannot open properly the doors. At times it opens, at times it doesn't open. When at times, by good luck, if it opens, the glucose will go in. At times it doesn't open, the glucose will remain floating. So eventually the sugar levels gone rising, because now you can see at times you see they are coming in, they cannot. So the sugar levels goes on rising, and that is diabetes type 2. The insulin is produced, but it is fake. Something has gone wrong with the factory. The factory has not shut down, but the things it's producing, the body cannot use them to enter this glucose to start making, to make energy.
Yes.
So that's what we call diabetes type 2.
Good.
So,
I love the illustration.
So that clear. Is the diabetes, how it is. So what we are going to find out is, of course, the symptoms for type 1 and type 2.
They're different?
They are the same. Because
Give us a picture, because in the next few minutes we will be taking a break. But in the 5 minutes, tell us the symptoms and how different or same
they are
they
the
are.
same. Of course, one of the major, they all have the similar symptoms as you are seeing them there on the screen. One of it is what we call thirst, because still the sugar levels are high. Sugar levels are high, so the body system has a duty to control it. Now it's going to control it through the kidney by pushing out the excess sugar out. That's why people who are having diabetes, one of the symptoms they get initially is feeling thirst and urinating. Feeling thirst and urinating. The body is trying to regulate this artificially. Then they get dry mouth, frequent urination, of course. Then unexplained weight loss. Others put on, we shall find out even why some people put on weight. They become tired. They get blood vision, because when the sugar goes into the capillaries of the eyes, it causes blood vision. Somebody's not seeing properly, you start getting numbness, things like dry skin. Then UTIs, urethral tract infections, start becoming a nuisance, because the more the sugar levels are in the body system, the more your body system becomes a beehive for bacterial activity. Bacteria survive on a sugary environment. So as long as your body system becomes sugary, then microorganisms are going to start making feasts. That's why you will find as we shall find out, one of the dangers of diabetes. As it goes on, when a diabetic person gets wounds, they don't heal quickly. Why? Because the wounds themselves are sugary, and so there's a lot of bacteria activity always taking place. That's why one of the reasons why the wounds take long to heal. To heal, yes. So that is how it is. That is the problem that goes along in the body system to bring this diabetes.
Okay, you were looking at the symptoms.
Yeah, we'll finish the symptoms.
Okay. So now I want to take you to something else, but after this very short break.
Yes.
Thank you so much for watching. We're going to look at more issues to do with diabetes, especially the major causes, and what exactly connects diabetes with food. So what do we have to eat to avoid it, or what do we eat that actually causes it? Thank you so much for watching. Enjoy this short break.
At Timex Nutrition Center, we advise you on the right foods to eat, exercise profile to adopt, and lifestyle strategies which are compatible to your blood group and genotype. This empowers your body to prevent and treat many diseases like diabetes mellitus, high blood pressure, arthritis, ulcers, obesity, and many others. Make food your medicine. For more information, find us at our head office on Conrad Plaza Building, Nassa Road, on the second floor, or call 0758 819 952 or 0778 288-361. In the Western region, find us in Mbarara on High Street Amazon Building on the first floor, or call 0754-918-590. And in the Eastern region, find us in Jinja on Main Street Kaki Road, East Arcade 82, or call 0701-458-064. Be your own doctor.
So much for watching. Welcome back from the break. We are still with Dr. Ishmael Tamale from Timex Nutrition Center, where they handle issues to do with Nutrigenomics. Somebody gave this program a name, the Nutrition Talk, and let us talk nutrition. Doctor, welcome back from the break.
Thank you.
Now, let us start with the causes, especially in relation with what we eat. Then we look at who is more prone.
Okay.
What are the causes of diabetes? We have looked at it in the biological sense,
okay,
in the terms of metabolism. Now, what are those things that we do that expose us to catching this problem?
The major causes of diabetes differ depending on the type. But we said this type 1, which is which affects about 15% of the diabetic people. At times it could be caused by infections into the pancreas, and then the factories can shut down. It could be a result of chemical toxins interfering with the beta cells, and then they shut down. Then it could be autoimmune reactions. Then at times it could be genetic, as we said, somebody is generally born with a disability. But the major cause, about 80% of the major cause of diabetes, if it is not if somebody was not born with it, okay, is what we call diet, wrong foods.
Okay.
Wrong foods which are not compatible to our blood group and genotype, lack of exercises as compared to our body system, and lack of and improper lifestyle strategies. And because of this, that's why when you go to other people to explain the cause of diabetes, they will tell you so many things, but they will all zero down to one thing: diet, exercise. Okay, one of the things they will tell you, obesity. We were talking about obesity the other time.
Yes.
And what is causing obesity? Not eating foods compatible to your body system. We saw the causes of obesity. Why obesity being a precursor for diabetes? Because as you go on putting on a lot of weight, that means the pancreas can no longer produce enough insulin to do that job which we saw. Okay? So eventually, and eating wrong foods, interfering with the beta cells, and then the factories get completely. Because to understand the causes of diabetes, we go back to the root. Where is the problem coming from? The problem is coming from the pancreas. It is coming from the beta cells. What is actually taking place there, that is diffusing, bringing all these abnormalities in metabolism. And one of it is eating wrong foods. These wrong foods, if you eat foods which are not compatible with your body system, they can cause an autoreaction. Not only in the pancreas, but also in other part of the body, in other parts of the body, and also in the pancreas. Like we have seen people, remember we talked about at that time, people who have allergies, and it says allergies are autoimmune disorder. Arthritis, joint pains is an autoimmune disorder, where the cells themselves start eating themselves up, including the lectins in wrong foods. So those reactions, like you see arthritis and anywhere, can be to the pancreas. That's why they talk of it, it's an autoimmune problem. Because they don't quite understand properly exactly what is taking place. But what is taking place, as long as you are eating lectins, not foods containing lectins, not compatible to your body system, those are some of the things you harvest.
Okay.
So the pancreas, the pancreas is disabled, it then starts producing fake insulin to start getting those problems. Of course, another thing they will tell you, bad diet. Let's see, we'll go back to what?
What we eat.
We'll go back to Nutrigenomics. You come back to Timex Nutrition Center. They tell you, oh, sedentary life. Sedentary life means people being there without having nothing to do. While sitting for a long time. Yes, that goes back to what? Diet, exercise, and life, which we are doing at Timex Nutrition Center. So you can see that all the reasons they tell you which are major causes of diabetes,
connect you back to one.
Connect it back to Nutrigenomics. That's why here in Nutrigenomics it becomes very easy to treat and even control and even forget about this diabetes. Then another thing they tell you, oh, stress. Still you come back to Nutrigenomics, because we give, I told you from the beginning, that Timex Nutrition Center will give you how do you control stress, and how do you avoid it, and how do you avoid it. Then injury,
avoiding control, and how you handle
it. Then they say high cholesterol in the blood. Hey, what is causing the high cholesterol in the blood? Still the wrong foods. Then the others will tell you alcohol. Still you go back to diet. Others will tell you things like autoimmune problem. See, autoimmune problem, what are causing the autoimmune problem? You see, viewers, they have to understand the word autoimmune. Autoimmune means it's like you have a country.
Yes.
Okay? You have a country with a very strong army, and it's on high alert. Okay? It's no nonsense. Okay? Then all of a sudden, maybe a can of Coca-Cola pops up and makes a noise. Pop! What will happen? They start firing amongst themselves.
Definitely.
They think there's an enemy. By the time they realized there was no enemy,
That it was a bottle top.
It was a bottle top. That's exactly what happened.
They have shot some people.
These body systems, when they have very strong immune systems, some of them, that's why body systems with strong immune systems are major victims of autoimmune diseases. That's why, remember we talked about blood group, all their diseases, allergy, gas in the stomach,
Yes.
ulcers, joint pains, asthma. So this is also what happens. Wrong foods, there are still the wrong foods will go and cause the problem in the pancreas, the autoimmune problem. That coupled with elections from wrong foods. We even know which foods are very dangerous to the pancreas for the production of insulin. And unfortunately, they are some of the delicacies of the people today.
True.
And you find somebody is having diabetes and is eating those foods because he thinks they have told him not to take sugar, therefore he's going to take those foods. And those foods will continue destroying the pancreas. They will continue destroying the beta cells.
Just worsening the situation.
So, yeah. Then eventually the sugar levels, he started up by taking metformin, he's taking glycoformin, then they are adding their insulin injections, and even having taken still all those 3 types of medication, the sugar levels are refusing, they are stuck in 15, 14. Okay. Why? Because they are not tackling the root cause of what is causing the problem. So, those are some of the things. Then they talk of family history. Of course, family history is that one I told you. Family history, of course, there are people who are more prone to diabetes mellitus. So if you have a family, if your body system within that line, as we shall look at them later, then you can have diabetes.
So because I wanted to mention something related to that. There are beliefs of genetic
You see, there is not
connections with diabetes.
It is not. It's not.
Munju muno sukali atutawa sukali abatawanya abantu bawo.
There is no gene for diabetes. That the man had diabetes, therefore the child will.
But you had the.
But what happens? There is no gene for diabetes. But what happens? Diabetes can run in a family. Why? I give you an example. As we shall go. People of blood group A and blood group AB. Okay. One of their biggest challenges, there is an enzyme called intestinal alkaline phosphatase, which is supposed to break down cholesterol. They have it in little quantities.
Okay.
That's why they are major victims of high cholesterol, major victims of fats, cardiac problems, blood clots, stroke, and diabetes mellitus. So if you are an A, and one of your children are A, and you have not come to Timex to change diet, if you get diabetes, just know your children who are also going to get diabetes because you are eating the same food. Okay? So if the A people, that's why you find in a family, the diseases differ. If you have a family which has children of A and children of O, they end up having different disease profiles. So to run in a family really is a result of, that's why you find that in particular families, people are dying of strokes, cardiac arrests, diabetes mellitus. Why? Same body systems will inherit same disease profile if they don't change the diet. If they don't come to Timex Nutrition Center to break down the chain. Okay. If the family is a blood group O, a blood group of viewers can testify this. A blood group O family, they are always with allergy, sneezing, wheezing, eating, allergy, gas in the stomach, ulcers, joint pains, sinuses, asthma, and high blood pressure, and prostate cancer in men after age 60. If they are not eating properly. So now if you are an old man and your wife is also old, then you produce the children old, the disease that will attack you will attack the wife, then the children's children, okay. Then that's when such things.
So that's how they come in lineage.
Yeah, we said diseases running in a family, but there are no genes that there's a gene of diabetes which was passed over to somebody. Then that somebody should have got diabetes at age 3, age 1. So then also this infantile diabetes, because now I told you that the diabetes now.
You see, these answers are just connecting you to my questions.
Okay.
Because I wanted to know who are the people more prone. Then we went to, you actually explained that while you were answering the genetic kind of issue. Now, I wanted to come to the infants that are talked about to be victims of diabetes. What have these babies eaten to
the children?
Diabetes? Yes.
Of course, if you look at children, for children, it can be two-way. It can be diabetes type 1, where they are born with that irregularity, deformity. Naturally, insulin is not being produced. So the child has to start injections from the beginning, insulin injections, to try to gap up the natural insulin.
Okay.
2, But the majority of children I've worked on, they are having diabetes type 2. And what has caused the diabetes type 2? From onset, they are eating very badly. You find a child is supposed to be about 15 kilograms, he's 20, 25. Okay? You find a child is in P3, you may think he's in senior 1.
Just like the ones we have
Yes,
after the lockdown.
So the lifestyle strategies for these children. And you will find it still the children who are mainly battling this diabetes. You'll find there are children who are coming from the urban centers. Because in the urban areas, there is rich activity, the money is always there, blue bandy, bready, milky, porco, sausages, then rich activities. So you find a child growing up. Then all of a sudden, the body system at that stage cannot even produce enough insulin to cater for the weight it's supposed to cater at that particular time. But the good thing that when they come and put the data right, they correct. Okay. That's the good thing about it. Yes.
Now,
so
how do you treat? First, finish with what you wanted to say, because this one is very crucial.
Who are more prone? You want to ask me who are more prone?
The people more prone.
Of course,
this treatment is so crucial. I don't want you to mix it with anything. Okay. First, finish with that.
Of course, we saw blood group A and AB are more prone to diabetes than other body system. Other blood groups also can have diabetes. For example, blood group O, of course, you are eating normal, pressure will come in, then eventually diabetes. Because they are all metabolic diseases. What we are seeing there is nothing else but metabolism. Yes. Metabolism, the rate at which the carbohydrates you have eaten after they have been broken into glucose, how they are turned into energy. And as we see, the next topic we shall work on will be high blood pressure. They are all metabolic diseases. Inability for the body to use the energy properly. That's what was being demonstrated there.
How do you treat diabetes mellitus?
Maybe I did not finish the who are more prone.
Okay.
We saw blood group A, blood group AB, and also blood group O if they are gatherer body system, GT4, and blood group B if they are gatherer and explorer. Those are the ones who are more prone to this. But otherwise, this is now when you come to Timex nutrition to know what genotype you are. Okay. Because why you have some O's who are prone to diabetes mellitus, especially if they are gatherers, that is GT2, and they are GT4 or explorers. So is the B gatherer and explorer. They're also prone to that because they have a problem of metabolism in their body system. Those particular body systems. But if it's a blood group B normal, blood group O hunter, diabetes is not so much in their line. Okay. Except if they have overused the body and they have got pressure, then of course pressure will trigger on the diabetes will come in. Okay. Because when you look at obesity, diabetes mellitus, and high blood pressure, they are all metabolic diseases. Inability for the body to use to break down glucose properly. Okay.
How do you treat diabetes in the first place? I've grown up thinking that this is a disease with no treatment. Is there treatment for diabetes?
There are so many treatments for diabetes. But the problem can you sure that
before we go to what Timex does to help me heal, there are so many. How many and which ones?
No, usually when you go to
the hospitals,
health workers, hospitals, and so on, they either give you this. They start when the sugar levels start becoming berserk, very far high. They start giving you injections of insulin to mimic the other insulin, so that it can help.
The ones I hear where the patients have to inject themselves on the stomach.
On the stomach, where so that it can mimic the other insulin to try to open up those cells and try to push in glucose. Then other medications, there are so many other medications like metformin, glyphosate, so many others are given to increase this, especially for diabetes type 2, to increase the sensitivity of that insulin which is fake. If you maybe increase its sensitivity, then you can try to open up it opens up the cells. Yes. But that means you are going to be swallowing this medication till death. Because if you are not because the problem is
The day you stop,
the day you stop, the sugar levels will go up. That's why they tell you
the cells will not open.
They will not open. Okay. That's why they tell you this diabetes doesn't cure. So that is the sort of others, they give herbs, all these are trying to reduce the sugar levels in the body system. Then as they are treating, they tell the patient reduce the take the sugary things, because they don't want a lot of glucose to start accumulating in the blood, because they're already fighting.
They're already fighting the too much in you.
Too much in you.
So if you add, you'll be
that's why they tell them to do A, B, C, D, E, F, G. That is the major treatment which most other people use. It helps to reduce the speed at which you are moving towards your grave, but it will not reverse it.
You will still go.
You will still go, because
but
you see, yeah, because you are not tackling the root cause of the problem. You are not tackling the root cause of the problem. Every day you are continuing to eat foods which are destroying the pancreas, which are destroying the beta cells.
There are some things they will give you, but what is now the right treatment according to Timex?
In Timex Nutrition Center, for us, as I at the beginning of the program, we go back to the root cause. Why the diabetes? You asked me a question. I was born in Noma. Why the diabetes? We have seen where the problem is. The problem is in the pancreas. The problem is with the beta cells.
First week, doctor. Now, that is when I come with already the problem.
You come with the problem.
At what stage can I come?
Anytime. Because for us, our work is to go back and start building the pancreas. So when you come, the first thing is to give you food.
I want someone to get this assurance.
Yes.
There are no chances of telling me I want to set to charge
for diabetes, unless you see one thing you have to understand. As diabetes goes on, it starts bringing other things. They start even, you say, I've seen people, their legs have been amputated, people have become blind, and so on and so on and so on. But it can be still manageable. But when it's not so terminal, others come when the diabetes has destroyed the kidney. What can you do about that? Kidney is dead. He's on dialysis. Resurrecting it is a problem. The livers are dead. He's blind. The eyes are gone. See, so that's another. That stage is very terminal. But let's say a moderate stage.
Okay.
When somebody has not, the kidneys are not yet gone, the livers are not yet gone. Because when somebody's livers start going and the kidneys, then that one is moving to another direction. But the people, as long as you have the diabetes and has not started destroying many body organs, because now what it means that if it has destroyed many body organs, then you have also start working on these other organs. But now we are talking about diabetes mellitus. Yes, it can be controlled and cured. Wow. One, the first thing to do is to give you the foods which are compatible to your blood group and genotype. So the body system will start reconstructing things in the pancreas, everywhere, to try to put back the normalcy. We have some food supplements which we give, but our food supplements for diabetes will be taken for 30 days.
Okay.
Only 30 days. They help in reconstructing the pancreas, the beta cells, to reconstruct the factories. What went wrong? What machine went wrong? Put everything together so that you can produce insulin, which is
needed within your body.
If it had shut down completely, they can open.
Okay.
If it was not a congenital thing that was born with it, but this is acquired diabetes type 1, the factories have shut down. Why? Revamp the production of the insulin, the beta cells start producing the insulin, and so on and so on. And by then, as you are eating the right foods to help the body do the proper thing, then we have seen people, they would come, then they say, I went to my doctor, he has reduced the dosage, and he tells me now, he has left me on one tablet. Now I'm taking half. Now he has told me to wait because it's now in 4.5. So that's how it is.
Because of the changes brought in by what they...
First of all, the first change is we have cut out the foods which are responsible for your diabetes.
Yes.
Number 2, we are reconstructing the factories. So you remain with this this medication you are taking, the chemical medication, as you observe. We don't tell you to remove it because it is very important, because at that moment it is the fire brigade helping to put the sugar levels down. So,
okay.
But as time goes on, the sugar levels stop going up, and then your doctor may go on reducing the medication as he's observing you, and then eventually you find that patients come back and they say, my doctor has told him to stop taking diabetes medicine.
Okay. Doctor, so diabetes cure. That one
Yes,
you
it
told
was.
us.
There's no question about that.
What are the
I've
major
seen
dangers with this disease that if somebody has it?
the major dangers of diabetes? Diabetes actually has a lot of one. As I talked from the beginning, diabetes destroys the kidney. It destroys the kidney.
When it goes to a worse level?
Yeah, it destroys the eyes. Yeah, diabetes will affect the heart. It causes heart failures. It can cause people to collapse. Then, because the body system is always sugary, a lot of bacterial activities take place, and you find that somebody is always having infections, and when the diabetic person gets a wound and is not eating, it may refuse to heal.
Okay.
Then it causes numbness. Then blood stops going to particular part of the body system. That's why you are seeing so many diabetic people being amputated. Then they start cutting off people start getting buried, so that by the time you die, some parts of your body were already buried.
Thank you so much, Doctor. Some closing remarks to somebody watching us about diabetes and how you do it at Timex to prevent and even treat. In just a minute, just wind up.
Not only diabetes, but when you have any ailment, whatever ailment you have, as long as you are treating that ailment without coming back to tackle the root cause of that ailment, the ailment is not going to go. You will continue taking medication, but every day you are eating foods and doing things which are increasing the ailment. This is not only for diabetes, but also for pressure, for joint pains, and all most of these diseases. So, come to Timex Nutrition Center and know which foods to eat to support your genes and cells.
Okay.
To be able to avoid. You ask me how do you prevent it. Once you come to Timex Nutrition Center and follow the diet, getting diabetes by mellitus will become by choice.
By choice.
By choice. If you by choice.
Thank you so much,
Then,
Doctor.
if you have it, the healing process will begin. Then eventually you'll find yourself getting free of medication as progressively. Yes.
Thank you so much, Dr. Ishmael Tamale from Timex Nutrition Center. If you can copy the numbers very quickly, they were there on your screen. Sorry, you missed. My name is Michael Jordan Okoma. That is all we had this evening with Dr. Tamale on our Nutrition Talk, like somebody gave the program a name. Thank you so much for watching. Let's get back to you with the news. Bye-bye for now. Doctor, thank you for coming.
You're welcome.
At Timex Nutrition Center, we advise you on the right foods to eat, exercise profile to adopt, and lifestyle strategies which are compatible to your blood group and genotype. This empowers your body to prevent and treat many diseases like diabetes mellitus, high blood pressure, arthritis, ulcers, obesity, and many others. Make food your medicine. For more information, find us at our head office on Conrad Plaza Building, Nassau Road, on the second floor, or call 0758 819 952 or 0778 288 361. In the Western region, find us in Mbarara on High Street Amazon Building on the first floor, or call 0754 918 590. And in the Eastern region, find us in Jinja on Main Street Kaki Road, East Arcade 82, or call 0701 458 064. Be your own doctor.